Good morning, good afternoon, and good evening to our audience around the world. I am Doug Silliman, the president of the Arab Gulf States Institute in Washington, and it is my great pleasure to welcome you today to the opening session of the 2020 iteration of the UAE Security Forum. Before we get into our program today, I have a few administrative announcements I'd like to make so everybody understands how this program is going to work. Today's session will be on the record and will be recorded. We will post the video to AGSIW's website so that it will be available on demand over the course of the next few days. All of you in the audience today will be in the listen-only mode for this session, but we encourage you to ask questions and engage with our speaker using the Q&A button at the bottom of your Zoom screen. So if you write your question briefly in the Q&A session, I will read them, consolidate questions, and then pose them to our speaker. So let's launch today's UAE Security Forum. The traditional views of security in academia and in practice have focused on the military, on intelligence, and on law enforcement. And a secure country has been one generally that was able to protect itself from external and internal threats and provide peace, stability, and law and order to its population. And it is clear that these elements of security remain very important in judging the security of a country and of its population. However, the world is increasingly looking at the question of security more broadly. Given the level of economic and population disruption around the world from conflict, the reality of the threat from climate change, and particularly this year, the impact of the coronavirus pandemic, this traditional view of security dealing with only military and law enforcement matters must be widened. AGSIW's visiting scholar, Emma Soubrier, last month published an excellent paper that provides a framework for broadening the definition of security to include elements that affect the daily lives of the people in a country. That paper, entitled Redefining Gulf Security Begins by Including the Human Dimension, is well worth reading in conjunction with this year's UAE Security Forum and is available on AGSIW's website, www.agsiw.org. And we will post a link to that paper in the chat function for everyone to access if you are interested right now. This year's Security Forum will begin to look at some of the non-traditional aspects of the security of the Gulf region and the broader Middle East. And over the next 3 days, we will cover 3 non-traditional aspects of security. Today, we will start this discussion with the need for public health security, particularly in light of the global pandemic. Tomorrow, we will examine the role of education and innovation in providing and expanding security in the Gulf region. And on Thursday, we will talk about how the impact of climate change and how the countries of the Gulf are trying to build green and to create a sustainable economic future for their citizens. So today we start with the discussion of public health and the steps that Gulf Arab states and others in the region are taking, and the need to provide, the need that they need to take to provide public health security for their populations. We have with us today from the Regional Middle East Office for the World Health Organization, Dr. Jafar Hussein, the Chef de Cabinet, the Chief of Staff for the Regional Director for the Eastern Mediterranean. Dr. Hussein, welcome to the program this afternoon.
Thank you, sir.
Let me start, if I may, with a very general question. How do you and how does the World Health Organization define the concept of public health, and what are the things that governments need to do to improve the public health of their citizens in a broad sense?
Thank you, Ambassador Silliman. Thank you first for having me or WHO on this forum, which is extremely useful. And also thank you for the Institute effort and particularly your efforts. Now, obviously, public health is well defined. I mean, we don't need to define it again. It's the ensuring access of each individual irrespective of race, economic status, and social status, to optimum health, both preventive, promotive, curative, and rehabilitative, wherever he or she needs it. So that's the broader definition, which we all subscribe to, the public health community as well as the decision maker. Now, in the context of health security, it grows out to many additional dimensions, where public health was traditionally seen as purely a medical or a health paradigm. The health security component of the public health has aided different dimensions, which primarily focus on ensuring that the health of an individual, the health of a community, the health of a society, and the health of a nation has to be the paradigm, the paramount importance and responsibility of not only one or a government or one entity or one group of experts or professionals, but it's a global responsibility. And the reason for pitching it as a global responsibility, because the health and health issues now have no borders. So we normally say that if disease have no border, then we saw it in Ebola, and we saw it now in, we are seeing it now in COVID and so many other pandemics or epidemics in recent history, that diseases have no borders, so health should not have no borders. And from a health security perspective, as much as the care approach or the healthcare approach is extremely useful, the fact that a disease at one level of a country or at one country means that a disease at any other country or any other level of the country. So while providing care, both preventive, promotive, rehabilitative is the essential component of public health, the health security component or the health security paradigm is essential, or the health security lens is essential, because that for the government ensures that the community and the population is protected and safe from both external and internal health threats in the form of whether outbreaks or any other issue. Now, for the government, the second part of your question, for the governments how to approach, I can assure you that the GCC countries particular, but many member states and countries in our region subscribe to very strongly now with the health security paradigm. They are signatories of the international health regulations. And during the COVID-19, although the preparedness level was varying, but still there were a lot of good lessons and good something extremely useful to offer on the preparedness. And that's why we did not see, except for few countries, an exponential increase of cases and deaths due to COVID-19, as we witness in many other regions. Thank you, Dr. Ambassador Silliman.
Yeah, Dr. Hussain, so what role does the World Health Organization play in the Middle East region, in the Eastern Med region, in assisting countries to put together policies and administer healthcare and provide for greater healthcare security for their citizens and residents?
Thank you, sir. Well, as you know, WHO is a member states organization. So our policies, our strategies are endorsed when we bring evidence as a secretariat to the member state, are endorsed by the governing bodies, be it the World Health Assembly or the regional committees. Now, in the pandemic, our role actually, not only that role was reaffirmed, but with the additional facets of the pandemic unfolding while the pandemic was moving on beyond February or January, WHO actually was looked at as an agency to provide a variety of different roles, which traditionally we were not very doing not in a pronounced manner. For example, the role of very effective coordination across countries and across partners within the UN and outside the UN. So the first role which WHO offered to the member state, and which is very much embraced by the member state, it's its convening, brokering, and coordination role, bringing the countries together, seeking a common platform for solidarity for actions, whether those were preventive actions or those were actions towards providing care to those who have been affected. Secondly, there was a massive procurement, supply, and logistic crisis with this pandemic, and we saw major market failures even among the most developed countries. And WHO offered its role and services to not only procure, but also make sure that even in the most complex circumstances where there were travel restrictions, airlines were not available, to ensure that through chartered airlines, partnering with other UN partners like the World Food Program, the UNICEF, and to ship life-saving supplies, particularly the PPEs, the testing kits, the ventilators and reagents, and then obviously the treatment or the management protocol. So we have a hub in Dubai, which serves not only for the region, but it has provided support to 110 member states around the world. And I think today's update was that we have been able to ship almost supplies worth $50 to $70 million to these different countries, which include a variety of supplies. So that was the second role, ensuring that even those who are in countries in complex emergencies like Yemen, like Syria, like Somalia, like Afghanistan, like Libya, receive the essential supplies, so they can test, they can isolate, they can treat, and they can follow and monitor. The third is the evidence base. And the evidence base is to collect data, first to empower the countries how to collect the different evidence, what we need to look into this pandemic as evidence. It's not only the number of cases or the number of deaths. There are so many other variables which are looked into this. And I'm glad our regional director also has joined. So thank you, sir, for joining. And I'm sure Dr. Al-Mandhari, because he's leading this role on behalf of WHO at the regional level, will add a lot of value to this. So the third was to collect evidence, look at the disease epidemiology, strengthen country capacity in that surveillance and collecting evidence at different level of the healthcare or the public health, district, sub-district, provincial or regional and national level. Collate, synthesize, and package that data so that it can give the country trends, the way the virus is behaving, whether there's a community transmission, how much extensive it is or how less extensive it is, and what are the lessons learned from the data, how the country should develop their key policies, strategies to address. The fourth one was the role is to provide effective capacities to the countries for case management. And we saw that at different level of the healthcare, the primary healthcare, the secondary and the tertiary care, that the case management was one of the major challenge of even the most developed countries because of the nature of the disease pattern or the nature of the symptomatology the virus was causing. Fifth, mobilizing resources for particularly those countries who could not have indigenous resources to respond to this pandemic and to the magnitude of pandemic. If I recall correctly from today's figures shared by our resource mobilization department, that we have been able to mobilize almost $500 million through different donors, to different donor countries, and to different levels for most of the countries who are unable to have this much resources to. Sixth, we indulged in very extensive research with the countries, with the institutions, particularly the academia and the collaborating centers, to do not only operational research, but also be part of the global research, whether that is around disease epidemiology, or that is around the case management, or that is around the vaccine now. And I'm sure the trials and all this you are. And then the last two has been risk communication, because you saw that, or we saw that there has been two epidemics. One was pandemic and the other one was what we call infodemic, because there was a plethora of information going from social media, from other forms of media to the communities and to the governments, which was in most cases a cause of confusion for the decision makers. And that is where we supported the governments and the institutions to have very targeted, effective, evidence-based risk communication. And then lastly, in all this, because COVID-19 also affected the space where the healthcare infrastructure can operate to provide essential health services. So we saw a downward trend in immunization. We saw a downward trend in care for the non-communicable diseases. We saw a downward trend in, for example, care for dialysis, for maternal child health. So we work with the governments, with the member state, to ensure that the bare minimum and the core essential services are available, even if the health system is hit by this massive response to the pandemic. Dr. Al-Mandhari, if you would like to add anything else, sir, over to you.
Thank you very much, Gafar, and please, Your Excellency, Ambassador Douglas, apologies for joining late and keeping you waiting, but in fact, I was having another meeting in which, in fact, will fit into your discussion, in this important high-level meeting and discussion. We are launching the Health Alliance that have been proposed under IMRO Vision 2023, Health for All by All. And this Health Alliance was proposed, 2 years back to bring all UN agencies and partners in order to make sure that whatever global action plan that have been signed by 12 sort of signatories and 12 organizations to make sure SDGs are really fulfilled, SDG goals fulfilled, and until the 2030 target. So apologies for being late. And in fact, thank you, Jafar, for adding your wisdom and words on this issue. But just a few remarks to add. Based on this Health for All by All, it is a call for action and solidarity. In fact, this COVID-19 showed us that it is the right slogan here in IMRO that we need. And a lot of activities haven't been done last year, but more of this year, bringing everyone, to come and serve the Health for All. We have been working for the last 2 years, and even before that, with parliamentarians, for example, making their active role and input into policies development at a country level, making their active role in moving a lot of policies, rules, and regulations, through different regulatory bodies in the country, and helping also ministries of health in getting their budget, for example, improved. We have many examples, like we have a group who's working on road safety, another group who's working on health in all policy, giving funds and supports to ministries of health. We have been also working with many other sort of academic institutions through what is well-known sort of framework, WHO collaborating centers. And here in the region, out of 100 and about 80 centers, WHO collaborating centers globally, we have around 45, 46 centers. But we are looking forward after 5 years of this vision to have more centers scattered in all regions, I mean in all countries of the region. And these are also adding to the value of the topic of today's meeting, bringing resilient communities through economic development. And we have been working with many other sectors, like, for example, the Islamic Development Bank, the World Bank, and many other donors to make sure that countries, low-resource countries mainly, are really supported and helped when it comes into dealing with whatever health challenges their systems are facing, particularly with this pandemic. So again, Your Excellency, it is my great pleasure and honor to attend this important meeting, and I wish you all the best. And we are here also at any time, Your Excellency and colleagues, and at your service for whatever you feel will help our communities and our countries. Back to you, Excellency. Thank you.
Dr. Ahmed, thank you very much. Ahlan wa sahlan. We're very happy to have you with us. For our audience, we have Dr. Ahmed Al-Mandhari, who is the World Health Organization's Regional Director for the Eastern Mediterranean, EMRO, the Eastern Mediterranean Regional Office. Dr. Ahmed, Dr. Hussein was telling us, in general, the role of the World Health Organization in the region and the world. I'd like to focus in a bit on some of the countries of the region, because there is, in the Middle East, a great variety of situations and the abilities to deal with healthcare issues. There are differences in resources, differences in social stability, several conflict areas. Can you explain, in your view from the World Health Organization, what countries or what factors make a country more able to provide public health security for its populations? Is it income level? Is it the type of government, a government that is more directive rather than open? Is it good communication? Or are there other factors that are important in governments providing good public health for their citizens?
Thank you, Your Excellency, for this important question. And in fact, briefly speaking, there are essential elements for us to say that this government, regardless of its income, will be able to provide whatever health needs, to its communities and individuals and citizens. And definitely, when we look at healthcare systems, we have to have, income and funds and finance to make us, efficient. I mean, to make sure that we are running our healthcare systems in a very good manner. But having funds and money is essential, but it is not a guarantee that these funds will be well utilized and directed. So, in order for that, to have, we have to have leadership top in the list. We have to have a strong, competent leadership. And strong, competent leadership is by all means, it doesn't mean the power, and the authority, but it means the wisdom, it means the knowledge and the skill at all levels of the country and at all levels of the healthcare system, from the minister level up to doorkeeper or, grassroots level staff. So we have to have that sort of competencies. So funds is one thing, leadership is another thing, and the third component is, as we always say, in our vision, health for all by all. Now it has changed from the past sort of understanding that health is the only responsibility of Minister of Health. It is no more applicable. That's why WHO have introduced several years back, health in all policy. And that's why we developed our own vision here, health for all by all. We move based on the fact that health is the responsibility of everyone. A child in a nursery or a school or in a university is playing a very active role in promoting the health of the community. A mother at her house, a father working in his farm or in a factory. So everyone should participate in developing and promoting the health of communities, and including all government sectors and private sectors as well. They have to come together in order to promote the health. And we have many successful examples around the globe, of such sort of concept. So,
Dr. Ahmed, where in your region are you most concerned about the ability of governments to put together, to construct a proper public health system? As I said, if money is not the most important issue, if it is a matter of leadership and communication, where have you seen the biggest problems, and what has the WHO or what has the international community more broadly done to try to help those countries? And this is not just with regard to the coronavirus, but more broadly, the establishment of proper public health systems.
Yeah, this is another, Your Excellency, strong and tough question that I must say. But I mean, when I look at these components and many other components for a successful healthcare system, I mean, one of the reasons that will make me direct our focus and attention to these countries are countries with sort of emergencies, either acute or protracted emergencies, either man-made or natural disasters, and emergencies. Because when it comes into these countries with instabilities, it has to be, given enough focus to make sure that healthcare system, we will not be able to prevent the impact of such instability on the healthcare system, but at least to make sure whatever impact is really at a very minimal level. And I'll give you one example, like, for example, retention of competent, qualified staff, mainly nationals. This is one of the challenges we are all facing. And it is not only, to be honest, in stable countries, but even stable countries are facing difficulties. So this is one issue that we need to focus. Development of managerial skills and leadership skills of those colleagues in stable countries or countries with conflicts. It is another challenge. As you see, Your Excellency, many countries with instabilities and conflicts are getting donations from different donors and member states. But sometimes these donations with weak infrastructure are not really well utilized or efficiently utilized. Yes, we have UN agencies there, but we still face difficulties. So that is another type of countries we are facing. The third type is, yeah, sorry, please.
No, Tafadhal, please continue.
Thank you very much. And the third type of countries that we need to give enough focus and attention is, countries that are lacking a sort of strategic plans, only, as we say, extinguishing fires. And this is something that I always tell my colleagues. I compare health problems like mosquitoes. If I just kill the mosquito each night, each mosquito comes to me, I'll kill, mosquitoes will continue coming to me forever. So I have to go to the breeding sites of these mosquitoes. Instead of killing the mosquito, I have to go to the swamps in which these mosquitoes are breeding themselves and coming all the day. And one of the issues that we are trying to work with our countries to look deep at what are the challenges, what are root causes of us failing in fulfilling whatever, overcoming these challenges and fulfilling the expectation, and work at it. And then from there, we take it further. Back to you, Your Excellency.
Thank you. One of the questions I wanted to ask you is also regional cooperation. I know that earlier in the year, Kuwait had suggested that the countries of the Gulf Cooperation Council should cooperate more closely on coronavirus. A number of the countries of the GCC, I think at the front of the queue is the United Arab Emirates, but others as well, have tried to reach out and provide assistance to other countries. Where has this been effective, and in what areas that you just mentioned has this regional cooperation actually been effective? Is it donations? Is it equipment? Is it planning process or help in retaining public health staff?
It is in fact a combination of many sort of support that's given by Gulf countries. In terms of financial donations, direct donations to WHO or to countries directly. The second type is equipments and machines and supplies, especially for COVID-19, like personal protective equipments of staff. Another support is a sort of political support, to WHO, generally speaking. And I must say here one good example of our WHO hub in Dubai, that have been serving countries around the globe, mainly with this COVID-19, politically and strongly supported by UAE government and mainly UAE, Dubai International Humanitarian City. The Gulf countries have been donating to different countries, as I said, with a lot of funds, especially with this COVID-19. It really helped us, WHO, and mainly IMRO, to move fast and smooth in supporting countries in need of these sort of funds.
And Dr. Ahmed, if I can ask a question a little bit out of your own personal experience. You are Omani. You were both the director of the Sultan Qaboos University Hospital and worked in the Ministry of Health. Oman is a country that has a relatively strong and efficient government, but often has limited resources to try to implement its policies. So what has been your experience? How has Oman succeeded in using limited resources in building a public health system that can reach out into rural areas, that reaches into less affluent areas of the cities? And what do you think has been effective? And what kinds of examples can the Oman experience give to some of your neighboring countries? I mean, the one that I'm most concerned about in the region is Yemen, but perhaps Iraq or Syria or Afghanistan or Libya, who do not have the strong government structure that Oman has developed.
Thank you very much, Your Excellency, for this question. And in fact, I may say that, again, to my previous answer, first of all, leadership. I remember, we have had, if I talk about ministers, for example, and undersecretaries, they were really strong enough to share with us their vision about the healthcare system. Where are we now and where they want us to be heading and reaching after a few years. So that's why they have started something called, and I'm sure it is there in many countries, the 5-year annual plans. Currently, this year, we will be finishing the 9th 5-year annual plan, strategic plan for the country, but for the healthcare system. So the leaders, they shared their vision in that plan. The second thing is capacity building and training of all those people who are working on implementing whatever visions and plans, both national and international staff at all levels, regardless of where are they coming from. So there was a lot of capacity building. And within that, they managed, to build the capacity of nationals at different levels, strengthening their leadership skills. The third point is working with UN agencies. And WHO is an example. From the 1980s, the country was working with WHO on different programs. And here I must mention, in fact, like, for example, the expanded program of immunization. Oman was considered one of the best programs through the primary healthcare system in strengthening that sort of thing and saving lives of children. Working with WHO, for example, in a very respectful, trustful manner, helped the country in moving towards developing the public healthcare system in a very scientific, evidence-based manner. And the fourth one is, as you said, Your Excellency, we have scarce resources, lack of resources, but that sort of challenge put us in a very tough situation that we have to make a balance. Yes, we have these funds, but we have to make sure that each pence of it or each dollar is well spent towards developing the health. So these are just briefly things that I'd like to share.
Well, Dr. Ahmed, thank you very much. I'm in Washington, D.C., and here over the past 24 hours, the first Americans have received their vaccinations against COVID. A few 100,000 out of what is going to have to be more than 330 million people who will be vaccinated over the course of the next year. Yeah. I know in the region that international companies have been conducting vaccine trials in, I I'm certain the UAE and Saudi Arabia and probably other countries as well. How has that been going? How have the local governments or the regional governments cooperated with the government of China, Chinese pharmaceutical companies, European or American pharmaceutical companies to conduct the tests? And I think looking at the population of the UAE, for example, you have a very ethnically diverse population. So you have a lot of different your genetic backgrounds in your sample to potentially work with. How has this operated, and how is the vaccine trial and vaccine administration of the population going in the region?
Yeah, thank you, thank you. In fact, I'm really proud of the work that is done by member states, as you said, mainly countries like UAE, Bahrain, Egypt, Pakistan, Saudi Arabia, Morocco, and Jordan, and many countries here in the region, in fact, participated in that sort of solidarity trial for the vaccines, either those coming from China, from US, from UK, and many of these sort of clinical trials help the countries, to build a sort of experience about the vaccine itself. And the good thing, as Your Excellency mentioned, it is not directed only to nationals. It included free of charge everyone in that country, like UAE. It has included everyone, citizens and non-citizens, And based on that experience, they have started, in fact, making agreements through the COVAX facility coordinated by WHO, or bilaterally with the countries and pharmaceutical companies producing these vaccines to get sort of the amount needed to make sure that their citizens and the people in these countries are vaccinated according to whatever plan that they have agreed upon with WHO and Gavi and UNICEF and other UN agencies.
Now, is this kind of cooperation also going to work for the countries in conflict? Again, looking at Libya, looking at Syria, at Yemen, Afghanistan, even Iraq to some extent. How do you think these countries in conflict will be able to get vaccines when they are available and then to administer them to their populations?
Yeah, in fact, this is another focus that we have been working in WHO. We have 22 countries in IMRO. 11 of these countries, as I said, are self-funding, countries through COVAX facility or bilateral agreements. The other 11 countries are either fully supported free of charge by WHO, COVAX facility, and UNICEF and Gavi to get these vaccines, covering the 20% of their population as an initial target, and then the rest for 2021. Or the other countries which are getting a low price, funded, supported sort of vaccine. So these countries with emergencies and instabilities, political instabilities, are at our focus. We have been working with health authorities in different sort of locations within the country to make sure that they will get. I agree with you. We are facing a lot of challenges and difficulties, but we are insisting, that we should really move when it comes into this right of getting the vaccine to protect people in these countries.
And what is the status? I know before the pandemic hit, EMRO had been working on setting up a number of public health emergency operations centers. This is a question we have from Bob Castro. But the pandemic has probably slowed down that process. What is the role of these public health emergency operations centers in both coordinating public health policy, but also in the very practical effort to coordinate administration of vaccines and the help to recover in these, especially the conflict countries?
Yeah, thank you, thank you. This is in fact another point that we have been discussing yesterday in our sort of. I had a meeting with the emergency department here in the regional office, and it came as one of the points that when it comes into lessons learned from this pandemic, we need to first of all strengthen those public health emergency centers in our member states to make sure that they are efficiently utilized in emergencies like this pandemic. And number two, to increase the number of these centers in the region, because as you have seen, with the closure of airports, cancellation of flights, we were facing difficulty in deploying our staff, WHO staff from the headquarters and regional office to these countries in need of that support. So this is another plan that we are going to make for 2021 increase or improve the efficiency of these current centers, increase the number in different countries to help and serve us, making sure that with minimal loss, are there during emergencies and instabilities.
Okay. No, thank you very much. As I noted, now that the United States, now that Europe and parts of Asia have begun to administer the first coronavirus vaccines to their population, the focus of government planning is turning away from public health toward economic recovery. And I know that this is going to be a major concern for both the WHO but especially for the governments of the region. So how is the World Health Organization suggesting to regional governments that they make the transition from the pandemic, and how do they safely reopen their economies and get economic activity going so that there will be more income and more people will be able to go back to their jobs?
Yeah, thank you. In fact, from the beginning of this pandemic, WHO was recommending all countries when on how best to deal with this pandemic by following the concept, the whole of government and the whole of society, and the integration between them. So government and non-government sectors, private sector, have to work together. People in the community have to work together and support each other. Based on that WHO is calling all countries, to make a plan when it comes into the recovery, or bypassing this critical or overcoming this critical period. Make a plan that yes, economy is important, and it is strongly linked with health of the communities, but whatever decision made by countries to sort of recover from this impact or reopen their activities, to consider essential sort of elements in their plans. First of all, they have to make an analysis of the current situation of the pandemic in terms of the number of the people infected, those deaths, availability of beds, the strength of the healthcare system, awareness of the community. And based on that sort of analysis from within the country, they'll start making sort of decisions on opening up whatever activities, and to continue adhering with the public health measures, social distancing, avoiding mass gatherings, these measures that helped us control the curve of the pandemic until we have all people vaccinated. And the third point is, look at the vulnerable groups, those who have lost their jobs or lost their income, to make sure that they are supported, they are considered in whatever plans we make, to avoid adding, to the suffering that they have already had before the pandemic.
And Dr. Ahmed, when do you think that the Middle East region, the Eastern Med region, will be able to open up again? For the United States, and this is my experience only from the news yesterday, we are hoping to begin vaccinating the general population, the healthy young population, by perhaps April or May, and have most of the population vaccinated by the end of the summer. What is the timeline for your region, and how does it vary from country to country?
Yeah, thank you. As you said, it varies from one country to another. Like, for example, if we talk about, high-income countries like the Gulf countries, or even the higher middle-income countries, like, say, for example, Morocco, Jordan, and other countries, they have a plan to come back to their not normal status, but at least, semi-normal as soon as possible. But as you said, I doubt that countries will be able to do it before, say, for example, the summer, in a full manner. Other countries that are in conflicts, they'll take a bit longer. Although in fact we noticed that communities have started, in fact, going back to their normal life, and sometimes, to be honest, not adhering to the public health measures. But we are monitoring these sort of behaviors, through close collaboration with health authorities, and also giving whatever recommendations, looking at numbers of those who have COVID, those who have died, the occupancy of healthcare systems, beds and ICUs, and these sort of things. And we have been trying to send messages that, to give focus to other non-COVID health related issues to make sure that health of the community is really maintained and avoid any sort of negative impact due to ischemic heart disease, diabetes, road traffic accidents, and other non-COVID health related challenges.
And as economies begin to open, I look particularly at the Middle East as a region that is very dependent economically on trade and travel. So for Morocco, for Tunisia, for Egypt, for Jordan, for the Gulf countries, because of the major airlines that transit through Manama and through Doha and Abu Dhabi and Dubai, air travel and open trade is going to be very important for their economies. How can these countries, what will they have to do to actually open up air travel? And what is the World Health Organization recommending to government in terms of documentation of having received a vaccine or the conditions under which people should be permitted to travel internationally?
Yeah. In fact, since the beginning of this pandemic, WHO was recommending all countries to strengthen their public health measures. It is a list of things that they have to do. As I said, like, insisting on wearing the mask, hand washing, social distancing, avoiding mass gatherings, and strengthening their healthcare systems. But at the same time, strengthening the point of entries monitoring system, identifying those who have the infection, trace the contacts, provide isolation or quarantine, for example. And as you said, sometimes, especially nowadays, some countries have asked for PCR testing, and it is like a certificate. If I want to go to this country, I have to have a negative COVID-19 PCR test, with me. It is like a ticket. WHO is working with member states in coordination and collaboration with other UN agencies to make sure that whatever recommendation given to these member states is based on evidence, and also at the same time not adding burden to travelers or burden to the countries. But sometimes, as you know, countries themselves, they make decisions based on their own analysis. So we are in close monitoring of these sort of decisions and close contact with the authorities in these countries.
And Dr. Ahmed, I want to thank you for the time you've taken and want to ask one final question that's come in from our audience. It's a rather general one, but I think it will rely on your experience and your responsibilities in the World Health Organization. As the world enters into recovery, how do you believe that the world in general, the World Health Organization and countries must optimize and prioritize the use of resources in terms of health, in terms of financial resources, to get the economies going and provide for public health and strengthen the systems going into the future? Where must money and attention be spent in the next 6 months or a year to optimize the use of those resources?
Yeah, thank you for this question. In fact, I just try to remember the report that have been published by United Nations and WHO, when it comes into what is the best option for countries nowadays after this 1 year experience with COVID-19. And it has been a call from WHO to all countries, all member states. They need to strengthen, their preparedness of, healthcare systems and the whole country, preparedness for whatever endemics or emergencies. And there was a calculation, I cannot remember numbers now, the cost. If we spend, say, for example, 1 million, each country spent, for example, 1 million on preparedness of their healthcare system or the whole system in the country, in 10 years, it will save us billions of dollars compared to just spending the money here and there without strengthening the system. And then after 10 years, having a pandemic, it will cost us billions of dollars that can be saved in these 10 years' time. So this is an issue that I think we have to work hard with member states and the decision makers and leaders in these member states.
Well, Dr. Ahmed, I want to thank you for the time you spent with us. To summarize what I think you have just told us is that resources are important, but leadership, planning, and communication and cooperation are really the things on which public health is built. and the WHO wants to play a strong role. I would like to thank Dr. Jafar Hussain, your Chief of Staff, for joining us early, and thank Dr. Ahmed Al-Mandhari for spending most of this hour with us and giving us his expert advice on the idea of public health as an element of the security of societies. For those of you in the audience, we will reconvene in a few moments for our second session for a broader panel discussion about public health. But Dr. Ahmed, Dr. Jafar, thank you very much. I appreciate your time and your expertise, and we will sign off for now. Thank you all very, very much.